think there's good evidence that Botox can be prophylactic. I think the term preventive Botox you get into a little bit of trouble with that, because I think the layperson doesn't really understand what that means. And so, I'll have patients who are in their early 20s come in with no sign of a dynamic line or static line. And they're like, just put some Botox in my forehead so I never develop lines. That's not how Botox works. So prophylactic Botox or preventative Botox, how we in the field discuss it, is more like, you raise your brows, there's a line, you relax it, and that line still sticks around for a few seconds or a minute before it goes away. That, you can intervene at that point and treat those potential lines so that they don't develop into permanent lines later on. So that's considered preventative Botox. It absolutely works. I used to have a line here that I no longer have, simply because of Botox. So I think that definitely works. And I think one of the things I wanted to get to at some point is like common myths in skin of color. And I think one of the most detrimental myths is this concept of Asian don't raisin, and that we never get lines or wrinkles. And that's just not true. And I think in skin of color, depending on the type of skin, if it's sebaceous skin, thicker skin of color, our wrinkles, our lines can actually turn into deepened creases or even scars in some patients if it's left untreated. So I think Botox plays like a very important role in skin of color.